Hi, my name is Mike Kruskamp. I'm going to give you a brief presentation on controlled substances in skilled nursing facilities. The goals of this presentation are to understand why a prescription must be written for patients in a skilled nursing facility, to know the requirements for a legal prescription, to understand agency agreements, to know the options to communicate a Schedule 3 through 5 prescription, to know the options to communicate a Schedule 2 prescription, and to understand the application of emergency Schedule 2 prescribing. To give you a brief history on this, recently there were very few law changes. There was a legal action against Omnicare from the DEA where many of the laws were clarified. One example of this is something that you may have seen as a continuance of therapy for controlled substance prescription. Essentially, the physicians are no longer allowed to just sign a refill request and send it back to the pharmacy. The physicians actually have to fill out the entire prescription and then send it back to the pharmacy. Some differences between hospitals and skilled nursing facilities is that a hospital has a DEA registration. And this DEA registration actually allows the physicians in the hospital to call controlled substance orders to nurses under that hospital DEA number for them to administer directly to a patient. Skilled nursing facilities are not registered by the DEA, so for purposes of controlled substances, they're not recognized as healthcare institutions, and so they have to therefore get a prescription issued to the pharmacy who has a DEA number to allow them to dispense any controlled substances, whether it's from the emergency backup box or any other type of an order that they might have. Hospitals are, however, similar to skilled nursing facilities in the prescribing of non-scheduled medications, as they can both write chart orders, and for maintenance medications there is no length of therapy required to be documented. Through all of this, the only law change that occurred is that the DEA drafted a law allowing skilled nursing facility employees to act as agents of the prescriber through a signed agreement. An example of this agency agreement was drafted into the Federal Register. Since you're probably used to chart orders, I'm going to go through prescription requirements. A prescription requires a patient's full name and address, practitioner's full name, address, and DEA number, the drug's name, strength, dosage form, and the quantity prescribed, up to 6 months for Schedules 3 through 5 and 60 days for Schedule 2 medications. It requires the directions for use, the number of refills authorized only for Schedule 3 through 5s, as Schedule 2 medications cannot have refills. The prescription must be manually signed and dated by the practitioner on the date that it was written. This is unless it was called to the pharmacy by an agent of the prescriber or the prescriber himself, or if it was called to the pharmacist from the prescriber directly in an emergency situation for a Schedule 2 medication. A little bit about agents of the prescriber. It is not legal for a skilled nursing facility employee to communicate a prescription to the pharmacy unless that skilled nursing facility employee and prescriber have signed an agency agreement. That allows that person to perform a limited role in communicating the prescription to the pharmacy. This means that for a Schedule 3 through 5 medication, they may call that to the pharmacy, and that prescription, once called to the pharmacy, is legal and does not require a physician's signature. They may also fax over a Schedule 3 through 5 prescription, but that prescription must have a physician's signature on it. They may also fax over a Schedule 2 prescription with a physician's signature on it. They may do nothing else. The physician may call over a Schedule 3 through 5 medication, and the physician may call over an emergency Schedule 2 medication as well. Currently, agents of the prescriber are their office staff, and this makes sense because normally an office staff member would call over a Schedule 3 through 5 medication for a prescriber, or they would fax over any Schedule 2 medications. These agents of the physician may fill in the information on a prescription for the prescriber to sign, which would be typical because you would fill in a Schedule 3 through 5 or a Schedule 2 medication and then fax it over to the pharmacy. In general, there are 3 allowed methods for communication of a Schedule 3 through 5 prescription. The original prescription may be delivered to the pharmacy. The original prescription may be faxed to the pharmacy from the prescriber or their agent. The prescription may be called to the pharmacy from the prescriber or their agent. If a legal prescription is presented to a skilled nursing facility, they may fax it to the pharmacy, then have the pharmacy pick up the prescription on delivery of the medication to expedite the process. This is in the case that the nurse at the facility is not an agent of the physician. For Schedule II medications, there are two allowed methods of communication. The original prescription may be delivered to the pharmacy, or the original prescription may be faxed to the pharmacy from the prescriber or their agent. If a legal prescription is present at the skilled nursing facility, they may fax it to the pharmacy and then have the pharmacy pick up the prescription upon delivery of the medication. In an emergency situation, it must not be possible to provide an original prescription to a pharmacist via hard copy or fax. In this case, a prescriber may call an emergency prescription, and this is the prescriber and only the prescriber. And they must call it directly to the pharmacist, no agent involvement. And only enough medication to cover the emergency period may be called to the pharmacist. Within 7 days, the prescriber must furnish the pharmacist with a written prescription to cover for the emergency dispensing. If no prescription is provided, the pharmacist must report the prescriber to the DEA. Failure of the pharmacist to report will result in loss of their ability to take a verbal Schedule II prescription. The emergency after-hours cabinet is an extension of the pharmacy. The pharmacist must review all orders of non-controlled medications within 48 hours of their removal from the cabinet. And a pharmacist must review that there is a valid controlled substance prescription prior to any controlled substance removal from the cabinet. Prescribers cannot authorize a nurse to take a controlled substance from the pharmacy, and that's what the emergency after-hours cabinet essentially is, the pharmacy. The pharmacist is at all times responsible for safekeeping of medications within the pharmacy. For your convenience, AIC has set up an emergency medication hotline. AIC has a pharmacist on call at all times. You can call us at 772-7770 and you can fax us at 772-7490. And we can check the fax anywhere we have an internet connection. For the convenience of our prescribers, an emergency controlled substance hotline has been set up. The number for that is 605-550-0005. This connects directly to the on-call pharmacist at all times. If the call is missed, an email and text message containing the prescriber's voice message will be sent to all pharmacists employed by AIC. This includes the manager, the owner, and all other pharmacists who are on call for AIC. So our intention is to hopefully have somebody contact that physician if the pharmacist who is on call for any reason is incapable of answering their phone at the time that the call is made to them. So in summary, controlled substances must be prescribed via a prescription. Versus a chart order, a prescription includes quantities and refills. Only nurses with agency agreements may aid in communicating prescriptions to the pharmacy. Schedule 3 through 5 medications may be communicated via phone, fax, or hard copy. Schedule 2 medications may be communicated via fax or hard copy. And an emergency Schedule 2 may be called directly from the prescriber to the pharmacist. If you have any questions, please submit them to Mike Kruskamp at AICRX, or you can submit them in the Contact Us section of KrusKampPharmacyInfo.com.